Their main business is basically cost savings in healthcare. So contract primarily with Microsoft and Boeing right now. Main premise is keeping people out of the ER. So we do telemedicine. We do web-based chats with people. Look at the camera. Okay. So we do web-based chats with patients who call in with just common concerns, sore throat, abdominal pain, things like that. We triage them on webcam, and if we can just treat them over the phone, we'll do that.
Oh, really? So it's like telemedicine with telepresence?
Telemedicine with telepresence, yeah. And, obviously if we need to escalate someone and send them to the ER, we'll do that. If they need some lesser level of care, but they actually need something hands-on, we'll send a doc or a nurse practitioner out to their home, which can be spendy, but it's a lot cheaper than actually sending someone to the ER. So huge cost savings. We just contracted with the Franciscan Systems down in Tacoma, and it's a pilot project using all of their subscribers in their health plan, and they're going to see over time if we can actually save the Franciscan system money by basically offering them after-hours telemedicine to keep their subscribers from having to go to the ER for simple common acutes that can easily be handled in a simpler fashion. So very exciting.
And tell me a little bit about the difference between being part of something like this and being part of what is the typical healthcare system.
So the difference is it has efficiency in mind. So it's really looking at every piece of it, analyzing basically how can you deliver the same quality of care at a cheaper price without diluting the quality in any way. So, for example, people go into ERs for sore throat all the time because they don't have access to a primary care, or they don't even have a primary care. So how can we deliver care to them in a way that's actually appropriate to the level of their needs at the moment without actually spending $2,000 for an unnecessary ER visit? So very conscious of that. The waste is minimized.
And so, what do you think of being in a space like this? What gets you thinking when you come to something like the Hub?
It's exciting. It's forward-thinking people. It's brainstorming. It's connections. I think something. For example, where I'm working, it was born of connections. It started just with one doc who decided that typical clinic visits was burning him out. So he decided to do some house calls, network with some other people. Somebody extrapolated that idea to doing web calls, to doing webcam visits. And now, just through networking, they hooked up with the whole Franciscan Systems, which is just thousands of subscribers. So it's all about the networking, and yeah.
Well, great. Thanks for doing this without any warning.
Yeah, right.
And now you're part of this whole venture space.
Excellent. Thanks, guys.